Hey, what's up, YouTube? Marcos here. I am making a quick little video about ACL reconstruction surgery and how it was for me. So I had my surgery Friday the 13th, which was 2 days ago. And the day of the surgery, I got there around 10 o'clock in the morning. I was released post-op at around 5:30 in the afternoon. I don't really remember a whole lot because the drugs were still wearing off. But I do remember waking up yesterday in pretty severe pain. I also remember not being able to sleep very well because I sleep on my stomach and I have to wear this super cool brace. And you can see there's a drainage pump here too. And the type of surgery that I had done, I had a ACL reconstruction using an allograft. For those of you that don't know, an allograft is a cadaver's tendon. And I also had a meniscus tear that was like scoped out. So I'm looking at about 6 to 9 months to return to like 100% full recovery. But I should be able to walk here unassisted, without using crutches within 6 weeks, I'm hoping. So, but anyway, a little bit about the experience. Expect not to be able to sleep your first night after the surgery. You're going to have this brace on, and you may or may not have a drainage bag, which is kind of gross. We'll discuss that here in a second. So if you can sleep on your side, just put a pillow between your legs and do that. And maybe if you take enough pain meds, you'll be able to go ahead and nod off for a few hours. I have been sleeping like crazy since this whole thing happened. I'm a pretty busy person. I don't usually get a chance to sleep a lot, but I've been sleeping during the day, sleeping whatever, just trying to recover as quickly as possible. So 24 hours after your surgery, the day after, it's going to suck. Expect to be in a lot of pain. Yeah, you're going to need some help. Make sure that you have a support system present so that you can, have somebody to lean on or have somebody to get you things, if you need them. Because you will not be able to do that for yourself the very first day after. Now, the second day, today, for me, I am a lot more mobile. I'm in better spirits. I am not in as much pain. I noticed that the swelling has gone down. I've been icing. I've been taking the wonderful Percocets. I also have been taking a 81 milligram baby aspirin to reduce the chance of deep vein thrombosis, which you're gonna have to do the same thing if you have this surgery, because blood clotting is kind of a risk. So they give you this super cool tight to wear. You get tights, man. You get tights on your on your other leg. So you're wearing tights on one leg and then your other leg's bandaged up. So it kind of looks like a leotard, but we'll call it a manitard, right? Manitard. Let's go with that. It's copyrighted. Don't copy it. All right. So they're going to give you a manitard to reduce the chances of blood clots, and they're going to give you this aspirin stuff, the Percocets, all that good stuff. You're just sort of kind of killing time until your first physical therapy appointment, which for me is tomorrow. So I am not looking forward to an excruciating session of physical therapy, but I am looking forward to getting this disgusting drainage bag removed. I don't know if I showed you guys that. So it fills up full of like fluid and blood and whatever, supposedly to help the wound heal faster and to reduce the chance of infection. But it is disgusting, and my wife, I felt sorry for her. She had to empty it a couple times. So love you, sweetheart. that's pretty much it. I just wanted to let you guys know that, so long as you have a clear idea of why you want to do the surgery, and for you it's going to be worth it. For me, my motivation was to have, to have the ability to keep up with my child, and not to be limited in my career choices, because I used to have a pretty active job that demanded a certain level of physical activity, and I would need to be able to have that level of activity again without worrying about whether or not my knee's going to go out while I'm running or something like that. So yeah, to get back to a normal life. So if you need the surgery, really, folks, there's no way around it. Just get it done. What you're gonna expect, it's gonna suck. It sucks for me right now. It's sucking a lot less than it did yesterday, but it sucks, So, but just go ahead and get it done. Especially if you have the ACL or the meniscus tear, and you have a choice on whether or not to do both, buddy, just go ahead and get them both done. The recovery time is a little bit longer, but you're going to have 100% functionality afterwards. From everyone that I've ever heard anything about this surgery, and I did a lot of research beforehand because I was scared to death of going in to the operating room. It was my first surgery. Physical therapy is really, really important, so I'm going to keep up with that. I'm going to make sure I give it 110%. And if you're watching this, wondering what physical therapy entails, I'm going to make another video tomorrow after physical therapy, let you guys know what they put me through, and what kind of things that go on there. So it's a process, and I wish that I'd had a video to show me exactly what to expect, and not just, oh, magically 2 days later I'm out of the hospital and whatever. Guys, it sucks. The first day, you're not going to remember a damn thing. Not really. The second day, that night post-surgery, the first night post-surgery, you're not going to be able to sleep. Just count on it. Just count on it. These are things that are going to happen to you. The first day after surgery is going to be by far the worst. Here we are on the second day, and already it still hurts, I could tell that something major happened there, but I'm in better spirits. I still need crutches to move around, obviously, but it's not a debilitating pain. I'm not bedridden. So I'm looking forward to tomorrow and getting this drainage bag removed. And another thing. Oh, one other thing that's going to suck about this, just to let you know, as if there weren't enough already, they're going to tell you that you can't shower or get this thing wet at all. So, you guys can't really tell how I smell right now, but I'll just tell you, honestly, not good. Not good at all. So, yeah. So anyway, that's pretty much it, YouTube. If you have any questions or comments below, I will give you an honest answer. And I don't want to discourage anybody from having the surgery, but I'm not going to sugarcoat a damn thing. All right, take care.